My name is Ryan Fleming. I'm a physical therapist and I work at Aquacare Physical Therapy in Salisbury. What I'd like to review with you today is going over a few basic exercises that you can start doing if you should develop back pain. Most of us will develop some type of back pain throughout our life, some more than others, and it's a very common condition. The exercises I'm going to show you are very basic entry-level exercises that somebody can begin typically after the first 7 to 10 days after your back injury if your symptoms start to improve. The first exercise I'd like to demonstrate is called the posterior pelvic tilt. Rachel's going to demonstrate. What you do first is you're going to pull your belly button in towards the table or the floor. You're going to gently tighten your abdominal muscles and roll your hips inward, which is going to cause a flattening of the low back. You know you're doing it correctly if the lumbar area is flattening against the table, the bed, or the floor. This is a good exercise for engaging the core abdominal muscles, and it's also good for helping to do a low-grade mobilizing or stretching of the lumbar region. The second exercise is going to be also done with a posterior pelvic tilt, and this sometimes we call marching or a bent leg lift. So you perform the pelvic tilt, you maintain the pelvic tilt and hold it, and slowly raise each leg in, pulling the knee toward the chest, not necessarily all the way into the chest. The key component of this exercise is making sure that you're keeping your pelvic tilt. The belly should flatten, the low back should go into the table, and do a slow marching, and make sure that you're doing these slowly. The third exercise is actually a combination of the first two. Again, Rachel does a pelvic tilt, and we're going to do an opposite arm and leg lift, where you're going to use the opposite sides and move them at the same time slowly, while keeping the core engaged and keeping the abdominals in a tight position, but you're not strained in that position. To make it more effective and to make sure you're doing it right, you got to make sure you're breathing throughout the whole exercise and not holding your breath. The last exercise that you can do while in the same position is called a bridge. This one, again, you're going to just perform a little bit of a pelvic tilt, and you're going to push through your legs and lift your body up until you just get to a straight position. You want to be careful not to hyperextend your back, especially if your back is irritated. So you're only going to come up to neutral. All these exercises you want to hold a couple seconds and then slowly lower it. An advancement of the exercises that were just demonstrated on the table could also be done on a TheraBall if you wish to purchase one or if you have one. First one, again, we're just going to review the same exercises. The first one is a posterior pelvic tilt. Same thing, belly button gets pulled in, the belly flattens, and you're straightening out the lumbar curve in your back. This is another really good way to mobilize the back, work on engaging your abdominal muscles, and it's very subtle and not very stressful on the back. Again, the second progression while using the TheraBall is marching, so hold the pelvic tilt and slowly alternating legs. By adding the TheraBall, we're now further working on our core and the stability. It's making it more challenging by providing an unstable surface. So we're going to add to the skill that's required, and we're going to engage the core. The third progression in the exercise is the opposite arm and leg. Again, pelvic tilt, alternate sides. Okay, do them slowly and keep the posterior pelvic tilt. If you lose it, you just perform the tilt again and just continue with the exercise. The last two things I'd like to demonstrate are stretches that can be done for the back. The first one's going to be done while sitting in a chair. You could utilize the ball. You're going to have a slightly wide base of support with the feet, so the feet come out. And the first thing that is done is you're going to lean forward, slowly stretching the back. We call this sometimes a three-way stretch with the TheraBall. You come back after a few seconds, and then you're going to go off on an angle. So you're going to go off to the side. And this will emphasize the stretch on the left side of the low back. You're going to come back in and you're going to stretch to the other side, which will kind of get the stretch a little bit more emphasized on the right side of the low back. Another good stretch that you could use towards the end of your workout is also done in what's called a quadruped position. So you'll be kneeling on the floor. Rachel will then lean over the ball and use the ball to provide a little bit of flexion and distraction of the low back. This is going to stretch the lumbar area, and it's going to give a little bit of an unloading effect across this region, or what some people call traction. This is going to help to loosen up the lumbar paraspinal muscles. It's going to unload some of the lumbar joints, and it's also going to provide a little bit of unloading to the lumbar discs. The last stretch we're going to show is a stretch that's going to be done in quadruped, which is kneeling. So Rachel's going to go down to the floor, so it'll be on her knees. What she's going to do is she's going to roll over the top of the ball, leaning forward, and kind of roll it out just slightly, just so the knees come a little bit off the floor. And she's just going to do some deep breathing. On the exhale, she's going to allow her back to just kind of flex and distract, or what you would call traction. And this is going to allow the lumbar paraspinal muscles to stretch. It's also going to unload the lumbar joints and give some relief to the lumbar discs by doing a little bit of a traction stretching. So you just hold this stretch for about 15-20 seconds, as long as it feels comfortable and it's not reproducing pain, and then you'll go back down to your knees to relax, and then you can repeat this stretch another 2 times.